Brought to you by WikiVidi.com. Botulinum toxin. Botulinum toxin is a neurotoxic protein produced by the bacterium Clostridium botulinum and related species. It prevents the release of the neurotransmitter acetylcholine from axon endings at the neuromuscular junction and thus causes flaccid paralysis. Infection with the bacterium causes the disease botulism. The toxin is also used commercially in medicine, cosmetics and research. Botulinum is the most acutely lethal toxin known, with an estimated human median lethal dose of 1.32.1 nanogram per kilogram intravenously, or intramuscularly, and 10-13 nanograms per kilogram when inhaled. The U.S. Food and Drug Administration requires a boxed warning stating that, when locally administered, the toxin may spread from the injection site to other areas of the body, causing botulism. The warning was the result of deaths associated with its uses. There are 7 types of botulinum toxin, named Type A, G, Type A, and B, are capable of causing disease in humans, and are also used commercially and medically. Types C, G are less common. Types E and F can cause disease in humans, while the other types cause disease in other animals. Botulinum toxin types A and B are used in medicine to treat various muscle spasms and diseases characterized by overactive muscle. The commercial form is marketed under the brand name Botox, among others. Botox is made by Allergan. Muscle spasticity. Botulinum toxin is used to treat a number of disorders characterized by overactive muscle movement, including post-stroke spasticity, post-spinal cord injury spasticity, spasms of the head and neck, eyelid, vagina, limbs, jaw, and vocal cords. Similarly, botulinum toxin is used to relax clenching of muscles, including those of the esophagus, jaw, lower urinary tract and bladder, or clenching of the anus, which can exacerbate anal fissure. It may also be used for improper eye alignment. Botulinum toxin appears to be effective for refractory overactive bladder. Other muscle disorders. Strabismus is caused by imbalances in the actions of muscles that rotate the eyes, and can sometimes be relieved by weakening a muscle that pulls too strongly, or pulls against one that has been weakened by disease or trauma. Muscles weakened by toxin injection recover from paralysis after several months, so it might seem that injection would then need to be repeated. However, muscles adapt to the lengths at which they are chronically held, so that if a paralyzed muscle is stretched by its antagonist, it grows longer, while the antagonist shortens, yielding a permanent effect. If there is good binocular vision, the brain mechanism of motor fusion, which aligns the eyes on a target visible to both, can stabilize the corrected alignment. In January 2014, botulinum toxin was approved by UK's Medicines and Healthcare Products Regulatory Agency for treatment of restricted ankle motion due to lower limb spasticity associated with stroke in adults. On July 29, 2016, Food and Drug Administration of the United States of America approved botulinum toxin for injection for the treatment of lower limb spasticity in pediatric patients 2 years of age and older. Botulinum toxin is the first and only FDA-approved botulinum toxin for the treatment of pediatric lower limb spasticity in the United States of America. The FDA approves the text of the labels of prescription medicines. The FDA approves which medical conditions the drug manufacturer may sell the drug for. However, those approved by the FDA to prescribe these drugs may freely prescribe them for any condition they wish, called off-label use. Botulinum toxins have been used off-label for several pediatric conditions, including infantile esotropia, migraine. In 2010, the FDA approved intramuscular botulinum toxin injections for prophylactic treatment of chronic migraine headache. Cosmetics. In cosmetic applications, botulinum toxin is considered safe and effective for reduction of facial wrinkles, especially in the uppermost third of the face. Injection of botulinum toxin into the muscles under facial wrinkles causes relaxation of those muscles, resulting in the smoothing of the overlying skin. Smoothing of wrinkles is usually visible 3 days after treatment, and is maximally visible 2 weeks following injection. The treated muscles gradually regain function, and generally return to their former appearance 3 to 4 months after treatment. Muscles can be treated repeatedly to maintain the smoothed appearance. Other. Botulinum toxin is also used to treat disorders of hyperactive nerves including excessive sweating, neuropathic pain, and some allergy symptoms. In addition to these uses, botulinum toxin is being evaluated for use in treating chronic pain. Side effects. While botulinum toxin is generally considered safe in a clinical setting, there can be serious side effects from its use. Most commonly, botulinum toxin can be injected into the wrong muscle group or spread from the injection site, causing paralysis of unintended muscles. Side effects from cosmetic use generally result from unintended paralysis of facial muscles. These include partial facial paralysis, muscle weakness, and trouble swallowing. Side effects are not limited to direct paralysis, however, and can also include headaches, flu-like syndromes, and allergic reactions. Just as cosmetic treatments only last a number of months, paralysis side effects can have the same durations, at least in some cases. These effects are reported to dissipate in the weeks after treatment. Bruising at the site of injection is not a side effect of the toxin, but rather of the mode of administration, and is reported as preventable if the clinician applies pressure to the injection site. When it occurs, it is reported in specific cases to last 7–11 days. When injecting the masseter muscle of the jaw, loss of muscle function can result in a loss or reduction of power to chew solid foods. Side effects from therapeutic use can be much more varied depending on the location of injection and the dose of toxin injected. In general, side effects from therapeutic use can be more serious than those that arise during cosmetic use. These can arise from paralysis of critical muscle groups and can include arrhythmia, heart attack, and in some cases seizures, respiratory arrest, and death. Additionally, side effects which are common in cosmetic use are also common in therapeutic use, including trouble swallowing, muscle weakness, allergic reactions, and flu-like syndromes. In response to the occurrence of these side effects, in 2008, the U.S. FDA notified the public of the potential dangers of botulinum toxin as a therapeutic. Namely, they warned that the toxin can spread to areas distant from the site of injection and paralyze unintended muscle groups, especially when used for treating muscle spasticity in children treated for cerebral palsy. In 2009, the FDA announced that boxed warnings would be added to available botulinum toxin products, warning of their ability to spread from the injection site. Additionally, the FDA announced name changes to several botulinum toxin products, meant to emphasize that the products are not interchangeable and require different doses for proper use. Botox and Botox Cosmetic were renamed Botulinum Toxina. MyoBlock was renamed Botulinum Toxins, and Dysport name renamed Botulinum Toxina. In conjunction with this, the FDA issued a communication to healthcare professionals reiterating the new drug names and the approved uses for each. A similar warning was issued by Health Canada in 2009, warning that botulinum toxin products can spread to other parts of the body. Thank you for watching. Brought to you by WikiVidi.com. Please like and subscribe below. Please like and subscribe below.